the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. The CFSS process, what to expect in Minnesota. Minnesota has taken a progressive step forward in home care services. As of October 1st, 2024, personal care assistance has transitioned to Community First services and supports. For current PCA recipients, this transition will occur smoothly during your next annual reassessment. As long as there have been no changes in your condition, your care will continue without any gaps in service. For new CFSS recipients, you will be assessed under the new program guidelines and process. This guide provides an overview of the assessment and reassessment process as outlined by the Minnesota Department of Human Services to help you gain a better understanding of what to expect. Understanding the initial Minnesota CFSS assessment process. The first step in the CFSS process is to complete a comprehensive assessment through your agency. This helps determine both your eligibility for CFSS and specific care needs. Minnesota currently uses two assessment tools. The first, the MN Choices Assessment, an electronic comprehensive evaluation system, and the Legacy Assessment, a paper-based tool still used by some agencies with special approval from the Department of Human Services. Both assessment methods use identical criteria and formulas to determine eligibility, ensuring all participants receive fair and consistent evaluations regardless of the tool used. What happens during your CFSS assessment? According to the Minnesota Department of Human Service guidelines, your assessment will be conducted in person if you're receiving CFSS services only. If you are eligible for waiver programs or alternative care, your assessment might be conducted remotely in certain circumstances. Minnesota CFSS consultation providers can help you through the process if you need assistance. The assessment serves as an essential purpose, documenting your needs and authorizing appropriate services. Whether completed through the electronic MN Choices Assessment or the paper-based Legacy Assessment, both tools use the same criteria and formula to determine your eligibility for services. During the assessment, it is important to provide accurate and complete information about your needs. This helps ensure your care plan is properly documented and appropriate services can be authorized. Overview of the annual Minnesota CFSS reassessment process. To continue receiving CFSS services or to transition from PCA to CFSS, if you have not yet done so, when you are due for your annual reassessment, you must schedule a reassessment. As the recipient of care, your primary responsibility during any assessment or reassessment is to provide accurate and complete information to ensure proper service authorization. Reassessments are required in two specific situations. The first, annually, before the end of your current service agreement, and secondly, when you experience a significant change in your condition. The process follows these key steps. Initial request. For those using the CFSS agency model, your provider agency will send a referral for assessment to the lead agency. For those using the budget model, your financial management services provider will submit this request. This occurs 60 days before your service agreement ends. Reassessment completion. The lead agency will conduct your reassessment. If you only receive CFSS services, this must be done in person. If you're eligible for a waiver or alternative care programs, remote assessments may be possible in certain circumstances. Assessment outcome. Once the reassessment is complete, your services will either be authorized or a change in condition will be noted. Service authorization. Following the assessment, the lead agency develops a support plan and creates a new service authorization. Change in condition. If you experience a significant change in your health status between annual reassessments, you, your CFSS agency, or FMS provider may request a reassessment form from DHS. The lead agency will then determine whether to complete a 45-day temporary increase in services or conduct a full reassessment. Best Care can help. Best Care is here to help you understand and navigate the CFSS assessment process. Whether you have questions about your assessment or need guidance about changes in your care needs, our team is ready to support you and your family throughout the caregiving journey. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.